Rohan Khera and Gibson coming to you live from ACC 2025, and we're talking about the use of AI, particularly in cardiovascular imaging. Rohan, you're really leading the field here. Talk to us about the recent advances and what do you see the future as in AI in cardiovascular imaging?
Hey Mike, thanks for having me and meeting with me at ACC. It's a fun venue and a lot of exciting science being presented here, which I think really talks to the point about AI, especially in the domain of disease diagnosis. And initially, all applications of artificial intelligence were focused on diagnosing what we could see with our eyes, but make it easier. What we're seeing more and more, and I think is the future, is picking up subtle signatures of diseases that are harder for us to pick up, like cardiac amyloid and others, which are very challenging for us as readers to pick up on simple technology like electrocardiograms or cardiac echocardiography.
So the Mayo Clinic can tell us if someone's a man or a woman if they had recent AFib, but can they tell us if someone has amyloid? Are we there with AI and the EKG?
We can.
You can, really?
Yeah.
You have the technology?
So we built a technology that takes a photo of an ECG, just a single photo of an ECG, that can parse and find out if somebody has cardiac amyloid.
Wow. And it's a black box thing, I'm sure, but is there anything inside the black box that's guiding you as to how it's figuring out that someone has amyloid?
So we've put in this heat maps on those ECGs just to see what might it be. And we found that on the precordial leads, especially in the QRS complexes, there's some heat signature there. We don't know exactly what it is, but it does seem to be something around the ventricle depolarization that's playing a role here.
Amazing. How about in imaging like echo? Anything, we have a sense of thickening, but any diagnostic criteria using AI?
So we put out the study in Lancet Digital Health last month, which just taking point of care ultrasound, so no advanced testing, just simple cardiac imaging. We were able to distinguish different forms of LVH. That comes from cardiac amyloid, from aortic stenosis, and hypertrophic cardiomyopathy, without actually being able to diagnose them both in measures alone. So clearly AI can pick up signatures, subtle wall motion differences, or the patterns of thickness that are very specific to each of these disorders.
Talk to us about the Trace AI study.
So Trace AI is I would say a very innovative concept because we're doing multiple things together. The idea that you can diagnose cardiac amyloid and ECG is confounded by the fact there's going to be a lot of false positives. And you apply on echo, similarly a lot of false positives there. But what if somebody has the electrical signatures of cardiac amyloid and the mechanical signatures of cardiac amyloid, and you find the overlap, the Venn diagram where it overlaps? That's the pool that's highly enriched for cardiac amyloid. So that's the basis of Trace AI. And we're doing it in a federated fashion, where we're deploying our models across sites without taking data from them. So we're sending our models over, they're deploying on their electrocardiograms and echocardiograms, and we're assembling the data to show the burden of undiagnosed cardiac amyloid based on these signatures.
Now that's fascinating. How much undiagnosed amyloid is out there?
I mean, a lot, because we are less than 1% of the people have known cardiac amyloid, and we see population estimates from 5 to 10% in high-risk groups like valve disorders and people with heart failure.
Really, so more than we thought.
Yeah, definitely.
Well, you're doing such a great job, Rohan. Keep it up. Love your work. Thanks for joining us here today, and thanks to all of you for joining us here live from ACC 2025.